So now we shall discuss some of the most important surgical points within the abdomen. Okay. So first of all, let me draw this part. Right. Now all of you know that exactly in the center over here we have got our umbilicus, right? And the next important thing is that you also know that this point whichever I'm drawing, this is your xiphoid process. Okay. So from here whatever you get is your costal margin. So these two are your costal margins. Okay. And all of you know that here we have got our right clavicle and here we have got our left clavicle. Okay. Now as you come down here, here you have got a spine here, and this spine is called as anterior superior iliac spine. Okay. And after anterior superior iliac spine, you see this part over here is called as your pubic tubercle. Okay. So let me put up this tubercle over here. You see this bumpy elevation? This bumpy elevation is called as pubic tubercle. Now all the way from anterior superior iliac spine till the pubic tubercle, whatever you have is inguinal ligament. Okay. Now what I am going to do is that here, for example, if I draw a line touching the umbilicus to anterior superior iliac spine, see this dotted line whatever I am drawing, this is the line touching the umbilicus to anterior superior iliac spine. Now if I divide this line into two halves, what do you mean by two halves? For example, this is the point where I am putting, right? So for example, if I am dividing this line into two halves in the sense medial 2/3, lateral 1/3. Okay. So this half would be medial 2/3, right? And this half here it would be lateral 1/3. So the point from medial 2/3 to lateral 1/3, right? So exactly this point in the center, right, connecting the junction between the medial 2/3 and the lateral 1/3, right? So this point here is called as McBurney's point. Okay. So this point over here is called as this point over here is called as the McBurney's point. Okay. And next, all of you know that in the center over here like this, we have got another important line. This is called as Linea Alba. What is this called? This one is called as Linea Alba. Right? Now, all of you know that at the level here already we have discussed, just below the L1 we have got a plane called as transpyloric plane, right? So here at the level of L1, let me draw a plane like this. This plane is called as transpyloric plane. Transpyloric plane, right? Now once I have drawn the transpyloric plane, now what I will do is that exactly from the mid part of the clavicle I will draw a vertical line downward. So exactly from the mid of the clavicle, if I am drawing a vertical line downward, so the point where the transpyloric plane meets with the line which is drawn mid clavicularly downward, exactly here, right? So this is the point for a 9th costal cartilage. Okay. So what is this point over here? This is the point which is called as the tip of the 9th costal cartilage. 9th costal cartilage, and this point is also called as your Murphy's point. Okay. What is this point called as? Murphy's point. This point over here is called as your Murphy's point. Now we shall discuss about the regions of the abdomen. What are the regions of the abdomen and into how many regions your abdomen is divided? All of you know your abdomen is divided into 9 regions, right? So we shall discuss what are the names of these regions. I already know that you might be perfect with all these regions which I am going to discuss now, right? So let us take this picture. I know it is little bit cross, but still, yeah. So this point which is located between L3 and L4 is your umbilicus. So above the umbilicus you have got L3, below the umbilicus you have got L4, right? So exactly in between both of them you have got your umbilicus there. So exactly in between there you have got your umbilicus there. Now if I divide this abdomen, right? If I divide this abdomen into regions, so all of you look here now. For example, these are the regions. How am I dividing the abdomen? How many regions are there now? There are completely 9 regions, right? Now in these 9 regions, what are the names? The region which is located above the umbilicus there is called as the epigastric region. So this is epigastric region. Okay, epigastric region. And the middle one is called as mesogastric region or umbilical region. This is called as umbilical region, okay, or the mesogastric region, or the mesogastric region, okay, umbilical region or the mesogastric region. Now after that, you have got another region here. This is called as a right hypochondric region, okay. So what is this region here called as? This is called as right hypochondric region. So when I tell right hypochondric region, this one is called as left hypochondric region. So right hypochondric region we have got left hypochondric region. Next, when it comes here, this is the lumbar area, right? So this area over here is called as your right lumbar region, whereas this one is called as your left lumbar region, okay, right lumbar region and left lumbar region. And all of you know that here you have got your anterior superior iliac spine, here you have got your anterior superior iliac spine on the left, right? Exactly in the center, here you have got your pubic region. So all the way from the right anterior superior iliac spine till the pubic region, this is the inguinal ligament you have got. So it means this area should be called as inguinal area or inguinal fossa. So this is called as the right inguinal fossa. Okay, so this is called as right inguinal fossa, right iliac fossa. Right, whereas this one is called as the left iliac fossa. So one is called as the right iliac fossa and the other one is called as the left iliac fossa. And by the way, this region which is in the center, this is called as a hypogastric region. Hypogastric region. So how many regions of the abdomen you have got? You have got 9 regions. So epigastric, mesogastric, hypogastric, right? Why you called as hypochondric? Because here you have got ribs. Let us say this is the sternum like this, right? And here you have got ribs like this. Yes or no? Here you have got the ribs. So anything below the ribs is called as hypochondria. And this region is perfectly beneath the ribs. So you have called it as right hypochondric region. And one thing to remember is that in the right hypochondric region, the organ you have is liver. In the left hypochondric region, behind the 8, 9, 10 ribs, the organ you have is spleen. Okay. So liver is usually palpable, but spleen is usually not palpable. Okay.